want to thank you all so much for inviting me to come to Fenway Health. I got to be a little bit honest with you. When I heard the word Fenway, I stopped and didn't hear the word health because I'm a huge baseball fan. Huge baseball fan. I think what you all are doing at Fenway Health is actually far more important than any baseball game will ever be, because you all are out in the community saving lives. And Lisa, I know that you're the director of the LGBTQ Aging Project here at Fenway Health. Gabi, I know that you are the transgender engagement liaison.
Specialist,
transgender engagement specialist here with Fenway Health. I don't think that people really understand what Fenway Health does for our community. So Lisa, I would like to start with you if possible. If you could kind of give a background as to what Fenway Health's LGBTQ Aging Project is and how you became involved with it.
Sure, thank you, and thanks for the conversation today. So we sort of started in two separate tracks. Fenway Health is celebrating its 50th anniversary as an LGBTQIA plus inclusive healthcare center. So this year is an exciting year for Fenway Health, not Fenway Park, and has been providing healthcare for our communities in a variety of ways over time, and particularly having developed a trans health program that really speaks to the particular issues that transgender and gender diverse folks have in terms of healthcare. The LGBT Aging Project, separate from that, started about 20 years ago as a community engagement. We were a separate entity for many years, and then in 2013 we became part of Fenway Health. So we then merged and became part of the overall Fenway mission to be attending to LGBTQIA plus older adults.
So you must have seen that there was a program that was needed for the LGBTQ community that were of a certain age, of my age.
So there's sort of two different elements. Fenway Health, as a federally qualified health center, has an amazing transgender health program that is really dedicated to the healthcare needs for folks. And distinctly, the LGBT Aging Project has been focused on working for full inclusion and equity for LGBTQ older adults so that they can age with dignity and respect. So we have, over these past 2 decades, been doing cultural competency training with elder care providers so that they can be welcoming in their senior center or their nursing home. And then we've been engaging in creating spaces for LGBT older adults to come together and feel a sense of community. And then we've also been working around policy and advocacy issues on a larger level. And I think that over probably our first 15 years or so, we're not seeing many trans folks who are coming out to our events, and we weren't connecting with them. And really, I think, are always mindful about who are we not seeing at the table, and what does that mean? And we had done a similar effort to engage LGBT older adults, elders of color, probably 7 years ago, to try and engage stakeholders in the community and help them create a place where they could fully bring their identities. And so over the past few years, we have been thinking that we really want to be able to reach out and engage transgender older adults, and both to be able to help create community, have that sense of connection for them, but also just to find out sort of where are they and what do they need, and is there something that we can do to assist them, particularly as they're addressing elder care. And how they navigate those kinds of engagements. And so we spent some time and put a grant proposal together, and we're fortunate to get funding from the Eugene Lang Foundation to fund a part-time transgender aging engagement specialist. And so we posted that position, and we also felt really strongly that what the ideal person for us would be a transgender person over the age of 50 who could go out and do the networking and connect to people. Both Bob and Scott, the other staff person, and myself are both cisgender, lesbian and gay identified, and so really felt like we didn't do the service right for us to be going out and doing that work. We wanted somebody to do peer-to-peer connection. We also wanted somebody over the age of 50 who could be able to sort of connect with folks, and so not necessarily bringing on a 30-year-old person, because those experiences can be so different. So we posted the job and got a small handful of resumes, and one resume stood out heads and tails above the other. And we did an interview via Zoom, and that is how Gabi Morgan came to be our additional part-time staff person working on this project.
That is fantastic. And I think one of the things that you pointed out that was we wanted representation from within the community. We wanted someone that when people talk to us, they can see themselves reflected in that person. Now, the project itself, let's kind of get into what the nuts and bolts of it are.
Well, one of the things I try to mention right up front, I'm not a therapist, a psychiatrist, a doctor, a professional that way. Kind of like in a 12-step program, the people you would work with, a sponsor or a mentor kind of thing, is somebody who has the lived experience. So I can't say, well, I can help you because I read this out of a book. I can say, well, you know what, I went through that, and this worked for me. This maybe didn't work for me. So a lot of times I can help point them in the direction that worked for me, or somebody that could be helpful, because every person is different. I mean,
exactly.
I won't talk about the whole thing. I had a letter from somebody recently, and it was like 4 out of 5 things. It's like, oh yeah, I did this 3 years ago. I addressed that 2 years ago. Oh, that I haven't touched base on, but I know somebody who can, so we can make that connection. Through the Aging Project itself, it set up a lot of tools that we can use to translate into what I'm doing and speaking with people now.
Okay, so you're catching people then at every stage of transition, I'm assuming, correct? That's what you're not just trying to find people that are at the initial stage of transition at the age of 48 or 50. They could have transitioned 20 years ago and they're coming into this certain, a certain age, and they're wanting to become a part of it and be around community like themselves.
Also, when we sort of envisioned this project, really also find this as to be sort of a fact-finding mission. I think we talk when we all meet together about sort of who are we meeting, who are we not meeting, and that the idea is really to go far and wide with whatever trans experiences people have had over the age of 50. So if it's meeting folks who transitioned decades ago, if it's people who are in the midst of that, and I think also a little bit of fact-finding about what's going on, what's working well for you in your life, what are the issues that you're thinking about or that you're facing. Is there then any kind of service or programming that we could help to create and sustain that would be meaningful for folks? But I wasn't going to presume to have any idea what the needs were. We're not going to start a social gathering if really what people need is assistance around housing.
What are some of the needs that you're coming across here in the Boston area?
Well, little by little, and because when we started, as far as the way we were actually going to do each thing, we just said, I guess we'll see when we have to do it.
Yeah.
Because we weren't like continuing an existing program; we were kind of starting it in another direction, and we just as they come in, like I didn't anticipate some of the emotion coming in a few of the contacts I've already had, and and a few of the questions were I wasn't sure about that, but then once we talked about them, it's like, okay, well, we know where to go with that. By asking, finding out more about the people that do contact us, we're finding out from people we haven't met yet. Somebody comes in with something, whoever, we might have the answer from them down the road when we meet another person.
Yeah. It's amazing, and the community, like you were saying earlier, is so diverse.
One of the things, and with transgender, and you're from another part of the country, you've seen areas that weren't as open and welcoming as the greater Boston area. We're pretty fortunate where we are here right now. And if you said the word transgender to some people in Middle America, they'll respond with, oh, a guy in a dress. But there is so much more. And this is not just about transgender women. I mean, we look for and want to work with transgender men. I mean, coming in the other direction, non-binary, gender diverse, gender expansive. In that respect, people of color, people of different national origin. It is a whole community, just like any other part of life.
How are some ways that we can help them through the show and through other venues to get the word out of this wonderful project that you all are doing?
You touched briefly on starting this in the pandemic, and as Lisa mentioned, first thinking, oh, I'm going to be going out to this town and that town and meeting this person for coffee. Because we're on, in a Zoom mentality right now, it's helped us reach a little further around without trekking, an hour and a half to Haverhill or hitting the South Shore or Metro West or something like that. We can connect on a few levels that way, which can maybe make us make some better choices, to head up to Haverhill or Metro West or South Shore. It's like, okay, this is important and this makes a lot of sense for us. We can learn a lot from it. Let's go up there. Whereas before we might have been just kind of running up there and maybe, having it not be so fruitful.
During the pandemic, one of the things the Aging Project has done is, for the past year now, we have had weekly Zoom drop-ins. So twice a week, we get onto Zoom and we've had 25 people come and join us. And many of those folks there who are LGB folks will say, we don't have any transgender people here and we should, and we want to be welcoming, we want to be inclusive, but we don't know anybody to invite. And so I think some of this project is both to, reach out to folks and then to offer them, we want to think about creating opportunities for transgender folks to come together and to have that experience sort of echoed amongst their peers. And then also to offer those opportunities, come to the drop-in. Yes. You would be welcome there. There are also people who don't want to be the only one, and that's harder to do. So trying to carry the opportunity for people to sort of have shared identity, shared experience in that affinity group, and then also to integrate them into the rest of the sort of alphabet LGB folks who are also wanting to be welcoming and creating those spaces for them as well.
One of the things that I've been thinking about with the transgender community lately is we are actually also already part of there's transgender people that are lesbians, there's transgender people that are gay men, there's transgender people that are bisexual.
You raise that point, which is we spend a lot of time educating elder care providers around LGBT issues and Q issues. And one of the things we want to help people understand right off is there's a difference between sexual orientation, who you partner with, and gender identity and expression, which is kind of who you are on the inside. And so helping people to sort of, even though the letters go together, to understand a little bit about how they can be different for different people and they can change over time. The other thing that we have been doing that has, I think, been important in terms of sort of the visibility and conversations about trans folks is that we developed a training workshop called Transgeneration. Okay. And it's a 1-hour training that we have really been focusing on for both elder care providers, some older adult audiences as well, to really sort of help them understand a little bit more about some of the basics about what is gender identity, what is gender expression, what does it mean to be transgender, non-binary, gender diverse. And we're fortunate to partner with 2 authors, Jess Dugan and Vanessa Fabre, who created an amazing book called To Survive on This Shore, which is photo essays and then interview short, brief stories about a number, I'd say over 75 transgender older adults across the country.
Oh my goodness, that's wonderful.
And so by using those stories, those photographs and some of their stories, sort of underscoring and helping a broader audience of people see some faces, hear some stories, so that it's not an abstract concept, but being able to sort of share that out broadly to help other folks understand a little bit about the diversity and diversity of experience that people have had in their lives and sort of what it has meant to them. And that, I think what's been interesting about that is that our intention is, partially it's to help them to be more welcoming and inclusive in their own setting. So it might be in their assisted living or that might be in their senior center that they're welcoming for trans peers. But what we also find is enormously frequently is that they start talking about their family members. I've got a grandson, I've got a cousin, I've got a nephew, my child is doing this. And so it gives them an opportunity to talk about those issues as well. And through both their lived experience with family or friends and then thinking about peers. And also I think asking questions that, we sort of listen to questions and take them with good intention, even when they may not sound like the most polite question or understanding that. I did a presentation and some gentleman said, I have a nephew who now wants to be my niece, and I don't know what their surgery is, and how are they going to date someone, what's going to happen to them? And I said, I can't answer those questions because I don't know this person, but it sounds like you really are concerned that they are not going to be alone in their life. And that they're gonna, because they're like, how are they gonna get married and how are they gonna do this? And so being able to reframe it and help them sort of understand a little bit about what they were asking. And they said, yes, I just want them to be happy. How are they gonna do that?
One of the things that is always a challenge for a transgender person or in other areas is just to show other people that we're just like other people. We're not trying to be unique and standing out in a certain way. I mean, transgender people are also softball players, they're disc golf players, they go grocery shopping, and they keep up and they stream shows on Netflix or something like that. We do everything that everyone else does, and that happens, to transgender people, other people of all ages. And it's now with the aging as well, all transgender people, LGBT people, we have questions about getting older, and what about our health care, and what about a place to live in a couple of years, when the kids have moved away.
Serious.
I mean, all the serious questions that everybody has to face, well, yeah, we face that too.
I mean, housing and things like that, that's already a scare, like in Massachusetts, luckily, like we know, we have laws that protect us, but in other states, from Tennessee, it's actually illegal for me to use the women's restroom in a school as a teacher right now, like in this. So employment and housing, those are big time concerns for a lot of our community. And if you all can help ease that fear a little bit and help hold a hand a little bit through that, like I will need that at some point.
So we are in the midst of building New England's first LGBTQ-friendly affordable senior housing, which is going to be in Hyde Park in Boston, with a planned opening date of 2023. It can't be the answer for everybody because probably 75 or 80 people will live there, and that's, we can't reach everyone, but it is beginning to develop some places like that where people can feel like they can live in community. And then we also want to be mindful that, we've got a large population of people that are going to live in a lot of different forms of senior housing, communities or independently, and so thinking broadly about how do we make sure that those spaces are safe and welcoming for folks so that you have choices about where you live and that you feel safe and affirmed there. And I think that, in the process of Gabi reaching out to folks and getting connected to them, we also want to make sure that if we're hearing stories about situations that are not good, not safe, not healthy for people, we want to be there to help advocate for them and try to, create spaces that are safe and healthy and encourage them.
I mean, that's huge. To be able to, I can't even explain. Those are real world fears for everybody. Being homeless, being without a job. That's huge that you all are offering that. And Gabi, I kind of want to talk with you about Fenway in the sense that it sounds like Fenway has been a part of you since you've transitioned and like they were with you on your journey.
2016, when I came out, I was a couple months shy of 60 years old. I knew nothing about what to do. When people said, well, you got to go, as far as you can or anything like that, and I said, I don't know. Because, I thought maybe there might be some things, maybe in medical care, where somebody say, well, sure, we want to help you, but at that age, some of the procedures, they might be a little risky or something. Though I would have been disappointed, I would have understood a little bit. Anyway, I got directed to Fenway, right downstairs here, and I spoke to somebody who did something of an intake interview, and then I spoke with a doctor, and we talked for a little bit over an hour, and then we started on a physical transition program with HRT, and then moved on, a little bit here, a little bit there. A doctor had said, are we going to move forward? And I said, yeah, let's do that. And as we were talking, she's on her computer and she started sending setting out consults for me. And, the rest is history in that respect for me. And all along the way, I had built up such a respect for what was happening and how Fenway was basically saving me. There was another opportunity at a division of Fenway that opened up, and I had a couple of opportunities, and it said, yeah, I mean, I think I'm supposed to be with these people. And I've been with Fenway for about 2.5 years now. And as I say, the job I was doing really didn't have much to do with my transition outside of everyone being incredibly supportive and genuinely caring, not just, well, legally we have to allow you to do this or something. No, these people actually cared about it. And that made such a difference. And then when this particular opportunity as the transgender engagement specialist happened, it's like, yes, this is what I'm supposed to be doing, and I get a chance. I joke around, I use a thing, it says, I wanted to become that person I wished I had. So now I kind of have that opportunity to hopefully do that a little bit.
A lot of us coming out right now because we're seeing ourselves in other people, so we're like, okay, they've done it, I can do it. So more and more of us are coming out, which means more and more of us don't have a clue. Like you were saying, when I transitioned, I didn't know, but I didn't have a Fenway, Gabi. You know what I had? I had word of mouth. And I had a doctor here, I had a therapist there, I had an endocrinologist here, and there was no cohesive communication between any of those people. And with Fenway, it almost feels like you can transition, you can mature, you can grow older, you can be a part of the community, and Fenway will help you through that entire journey of your life as a trans person. And that's pretty new, and you all have to be very excited about what you're doing, because I mean that's just something that doesn't happen very often. Thank you all.
And we're happy to develop and create it. I mean, I was thinking earlier when you were talking that the issues about visibility are so important, and that we've sort of seen that, in the LGB world so much about sort of public invisibility and people coming out now, and then I think that there's a bit of a culture wave around transgender visibility as well, and yet I think so much of it is really sort of firmly entrenched in a younger generation, and so then thinking about older folks and thinking about where are the people who might have transitioned earlier in their lives and then maybe are not connected to community in any way, sort of went to live their new life. Where are folks who are at a later stage in their life and now saying, I better do this. I need to do this. So people may be in very, very different places, but working in LGBT aging, my job has always been to go into the elder care world and I say, LGBT folks, who have you got? What are you doing? And then also being in the LGBT community and saying, where are your old people? What are you doing? Because we're all, I like to refer to us as emerging elders, right? We're all going to get there sooner or later if we're lucky enough to do that. Absolutely. And so, there's a lot of ageism in our communities and in our overall culture, and how you embrace that. And, it's amazing that if you are, 4, every birthday is I'm 4, I'm 4 1/4, I'm 4 1/2, right? And then when you're 98, I'm 98 1/2, I'm not, right? People get very excited about your age. But that it's important to embrace it and to affirm people's lives, and that understanding sort of what their life course has been, whether it's been based in geography, identity, work experience, and the intersectionality around other identities that you hold, as you said, whether it's gender, race, ethnic, religious, whatever else, abilities, what else informs sort of the life that you have lived and the life that you want to live.
Being able to see someone that didn't buy into the ageism is huge.
And I did at 50, probably at 40, at 50, at 55. It's like, I wish I could tell somebody because I really should be me. And, but it's like, wow, God, come on, I'm 48 years old, it's too late, or something like that. I was a couple months shy. I mean, I don't know exactly. All right, it was 59 years, 7 months, and 21 days. That's when I told the first person who I really was. So,
What was that like?
well, I learned that life can begin at 60. I mean, I'm 65, or 65 in 9 days.
Well, happy birthday then.
Well,
Yeah.
exactly. Thank you. I had to get that in there somewhere, but it wasn't too late. And the 5 years since I started this journey have easily been the 5 best years of my life. And if I had said, "Oh, I can't do it because it was too late," it's never too late. I mean, 2 people I'm working with right now, the latest 2 letters I've had, 54 years old and 74 years old. So it's a range. You mentioned regrets or resentments a little earlier, and I was asked if I had regrets or resentments that I waited so long to come out, that I didn't do it at 15 or 20 or 25, or when I was born, the doctor said, "Look, you have a beautiful baby girl here." And I did. I had those regrets and resentments first. But then I stopped and thought, if it had been easier, not that it was easy back then, even if I had attempted it, but if it was easier for me, would I have the same wherewithal to want to give back right now? Would I have the same drive to do that? So I have to say, it happened for me when it was supposed to happen.
That's the best way to approach it. I
And
mean,
as far as why, if you ask us why, hopefully we can help you with how or where.
I mean, that's the thing. It is, and like you said, you won't have the answers to all the why questions, but it's okay to ask them. I think it is okay. Do you all have anything else that you would like to share with
So the only thing I would add is just that I think that our vision was that this year was going to be sort of the fact-finding and building, and I didn't, we didn't know if we were going to find 10 people or 100 people or who's out there. And that our idea is that based on that and on doing some surveys and assessments with folks, that it will help and inform us to figure out what kind of programming to develop.
Oh, okay.
So that it's not just we want to meet people and have a list of names, but that we're hoping that it builds a foundation and that we get a sense from people of what's important and what's needed, and that we would then have the opportunity in the coming years to create more programming that is specific to meet the needs of trans older adults, and then being more thoughtful about sort of how to, sort of bring messages around aging to other networks and systems that are providing trans care as well.
One of the reasons we don't have all the answers is because we're trying to figure out what all the questions are.
Exactly.
And I wish you all the best of luck finding our community.
Really, as you said, I think there's so many people who've used this saying, nothing about us without us. So we want to hear from people about what's important, whether it's socializing, whether it's healthcare, whether it's housing, or whatever that may be, and build from there with them so that we can help to kind of create resources and whatever it is that would meet people's needs, so that they have that sense of connection and they don't feel like they're aging alone.
Gabi and Lisa, I wish you all of the luck in the world with this project. It's really going to touch lives, and it's going to make a difference in ways you will never even anticipate. 20 years from now, some person's grandkid is going to be different because of what you all are doing now. And I'm very grateful, and thank you for giving me the time to do the interview. I appreciate very much what the Fenway Health LGBTQ Aging Project is doing. Gabi, I wish you the best of luck in bringing our community together and finding us, because we need to be together sometimes. And
Thanks for asking the questions and for giving us the opportunity to talk with you today.
oh,
Thank
no
you, Kelly.
problem whatsoever.
Thanks
It's been
so
a
much.
pleasure. And look, there's a baseball game. Right there.